Hi, my name is Bree Cowart. I'm a registered nurse, and this is discussion 3 for Nursing 7352. So case study 1, JK is a 15-year-old Caucasian male with depression, anxiety, panic attacks, and conflict with mother. He identifies as gay, gender neutral, and gender identity is the same as the one he was born into. He feels his mother is not pleased with his sexual orientation. He also feels as if his mother wanted a masculine son due to the lack of support from his mother, and upset due to not being whom she wants him to be in regard to personality and sexual identity. He has a relationship with his father, is strained, and his stepfather is also estranged, and he considers his stepfather arrogant. He attends high school and is in an art and band and is going into the 10th grade. He has friends, but no close friends. His strengths are art, band, being funny, fashionable, and smart. As far as his clinical concerns, there are patient and mother. There's enmeshment there. There's also, we're going to be looking at his anxiety. It's likely exacerbated by his mother's anxiety. There's a lack of support system at school and at home. Patient has some resentments towards his mother. Patient's emotional dysregulation. Patient sexuality not being fully accepted by his family. Patient's strained relationship with his father, and his patient's strained relationship with his mother's boyfriend. So my next case study is who is TD. He's a married Caucasian male who presents today for counseling. He's a retired United States Air Force sergeant who is having depression, unmotivated, excessive drinking, poor diet, sleep impairment, and memory loss. Signs and symptoms have been constant and ongoing since January 2020. He has some traumatic events, being present during Desert Storm, Iraqi Freedom, and he's also witnessed his dad and cousin's death. He's got a psych history. He had a suicide attempt in 2012. He has some addictive behaviors. He drinks alcohol, and he's been doing it for 40 years. He starts drinking at 10 to 12 o'clock in the morning. And he drinks about 9 to 14 beers a day. His parents had a total of 13 children, in which he's the baby, and he describes his childhood as being hard luck and misery. His father died when he was age 7, and his father's death changed the family dynamic, and siblings eventually all drifted apart. He also joined the military at age 18 to get away from his hard childhood. So assume that you are the client posing conflicts. What are you seeking? What resolution would you like to find? And what do you want from and with your counselor? So according to Carlett 2017, the irritable and depressed patient can come across hostile, but it is a hostility that cloaks a reservoir of pain. A good technique is to make a direct interpretation. Here's an example. You sound angry, but I think there's some sadness underneath that anger. And another example, I can understand how you would be angry with me, but I wonder if there isn't something beneath that anger that is eating at you. In my opinion, I would be seeking help and reassurance from the counselor. I would like to find answers, and I would want a counselor that listens without judgment, and one that processes the information, is knowledgeable on the subject, and gives feedback. In a recent research by Price 2016, barriers to treatment for college students included personal perceived fear of treatment, fear of emotional expression, anticipated benefits, and risk of treatment, and discomfort with self-disclosure. Generally, clients report a desire for a therapist who is warm, experienced, trustworthy, and focused on the client's problems, according to Price 2016. Andy George, Constantino, Greenberg, Swift, and Smith-Hanson 2013 found that overall men and women are similar preferences for personality type of their therapist. So these are my resources. So now you'll go back in, look at my case studies, and then to come up with interventions for existential therapy and gestalt therapy. Thank you, and have a great day.